Fastbreathe Thoracic Seal, FTS, the ultimate in penetrating thoracic wound care. Fastbreathe Thoracic Seal, FTS, is a laboratory and field-tested valved product designed to manage a penetrating thoracic wound that can, if needed, be covered by clothing, blankets, body armor, and still continue to function. Appropriate penetrating thoracic wound management is a key step in the stabilization of a patient. Choosing the appropriate equipment is key to effective pre-hospital and emergency management. Tactical Combat Casualty Care Guidelines for Battlefield Management of Open Pneumothorax state application of a vented chest seal as the first step in treatment of open and/or sucking chest wounds. An open pneumothorax is an injury to the thoracic wall that may or may not include injuries to underlying lung, blood vessels, or other body tissues. On the battlefield, these injuries are usually caused by penetrating items such as bullets or shrapnel. When the thoracic wall opening is large enough, usually 2/3 or more of the diameter of the trachea, air will enter and exit the thoracic cavity via the open wound. The patient may experience severe breathing difficulty and may become hypoxic because air is exchanged only through the chest wound, the path of least resistance. As demonstrated here, occluding the chest wound causes air to follow the normal pathway, the trachea. Some of the air entering the injured lung is now expelled into the pleural space and is trapped. A tension pneumothorax occurs when this trapped air causes progressive accumulation of pressure in the pleural space and collapses the injured lung and may push the mediastinum to the opposite hemithorax, which would compress the heart and other lung. This could impede venous return to the heart and make the lung and heart functionally ineffective, leading to circulatory instability and may result in traumatic arrest. Combining mechanically supporting ventilation with occlusion increases this risk. Use of FTS is intended to prevent the development of a tension pneumothorax by releasing air pressure built up in the thoracic cavity via a one-way valve assembly. When you encounter a patient, first determine whether the patient is a good candidate for FTS. Indications for use include presence of any penetrating wound or wounds in the thoracic region. These wounds must be managed immediately. If time and circumstance permits, clean the affected area. The included soft wipe absorbs 7 to 8 times its weight. If time does not permit, or a clean surface is not achievable, FTS will adhere to wet and dirty skin. Each packet contains one Fastbreathe Thoracic Seal, FTS. The seal is composed of an occlusive dressing surrounding a central one-way valve. The valve's hardened outer top with side ventilation prevents occlusion by clothing, blankets, body armor after placement on a patient. This enables FTS to be placed anywhere in the thoracic region without significant concern to external covers. The one-way valve assembly allows air to be expelled from the thoracic cavity and requires minimal pressure to function. Peel and place over wound. To place, grip green tab and remove protective blue backing. It is important that you use care when removing the protective blue backing material. Do not allow dressing to fold over onto itself. Next, place FTS directly over wound. When positioning the dressing, center the valve directly over the opening of the thoracic wound. The entire defect should be covered. Confirm occlusion and placement by applying firm pressure across the dressing's entire adhesive surface. HydroSeal technology provides aggressive adhesive yet gentle removal. The HydroSeal technology sticks to wet skin and allows for easy repositioning if needed. Look for valve movement. Opening and closing valve movement indicates successful placement. The one-way valve flap opens for air to escape and closes to block inward flow. The valve's hardened outer top with side ventilation prevents occlusion of airflow by any external cover. The one-way valve is designed to release air pressure that may build up in the thoracic cavity and reduces the need for manual venting or burping. A correctly placed FTS should vent an open pneumothorax and prevent development of a tension pneumothorax. Ensure all open thoracic wounds are vented, or when not possible, occluded. If multiple penetrating thoracic wounds are present, place FTS on all of the wounds. If limited FTS are available, they should be placed on the wounds deemed most likely to cause a tension pneumothorax, such as sucking chest wounds or large diameter wounds. Occlude additional wounds with Fast Combat Wound Seal, CWS6, or other available material. CWS6 is the non-valve version of FTS. To remove from patient, peel slowly and gently. The HydroSeal technology enables gentle release. The occlusive dressing bonds aggressively but will not damage the skin surface upon removal. To remove or reposition, pull green tab and peel dressing slowly and gently from the skin surface. To expedite removal, applying sterile water to the adhesive surface as it is pulled away from the skin overwhelms the HydroSeal and activates the easiest release. If using water to aid in removal, do not allow water to enter any thoracic wound. Fastbreathe Thoracic Seal, FTS, from Fastrack Medical Solutions.